Hey guys, my name is Christina and I'm a junior doctor working in London. Starting as an F1 can be quite overwhelming and difficult and stressful. So I just wanted to share my top tips that I wish I would have known when I started as an F1 and that hopefully will help you. So tip number one is you are not expected to know everything. However much you've worked at university, however much you've studied, however many books you've memorized, you will still not know everything. And becoming an F1 is still going to be a really steep learning curve for everyone. But that's okay, it's normal. Everyone's been in your shoes. No one expects you to know everything. You're new, people are there to help you, people are there to support you. So make sure that you're being easy on yourself and kind to yourself. Don't try to compare yourself to others. Be careful with imposter syndrome and feeling like you're not good enough. Everyone knows so much more than you, because it's not true. Everyone's in the same boat. Every F1 is new. Every F1 feels lost and overwhelmed. And it will get better. Tip number two, you're not alone. There is always someone that you can ask for help. If you're worried, if you're busy, if you're overwhelmed, this will be like your fellow F1s, other senior doctors, your registrar, your consultant, but also nurses, which can be really experienced, HCAs and phlebotomists, pharmacists. There's a massive team of people in a hospital which you can lean on for support and for help and for advice. So make sure you use them. Tip number three, be a sponge. When you start, as we said, you're going to be feeling lost, you're going to be feeling like you don't know much at all, but make sure you take every opportunity to learn. Ask questions to everyone around you. Say you're in a ward round and the consultant has given you a plan. Ask why we're doing this for this particular patient. Like that, next time you see a patient that's similar, you might have more of an idea of what to do with them. Also, make sure that you're aware of your weak points. For example, say that you're finding putting in cannulas difficult, and make sure you ask for help and advice. So for example, you could shadow a phlebotomist or ask them for tips. You can also ask your seniors for some feedback, and like this, bit by bit and without realizing, you will be learning so much and becoming so much more confident. Tip number four, know your patients. So this is really important. A lot of times seniors will come and go, but you'll be in the same place for a longer period of time. So you're actually really important for continuity of care. If you're gonna refer a patient, if you're gonna escalate a patient or ask for advice from another specialty, make sure that before picking up the phone to speak to them, you have gone through the patient's notes and know them very well. For example, what is the patient being treated for? What investigations have been done and what are the date and the result of these investigations? How is the patient clinically? So if you have a look at all of these things and write them down before you speak to them, the conversation will go a lot better and you'll also learn a lot more from it. Tip number five, be safe. Whenever you are in doubt, always ask. If you've not done something before, make sure you let your senior know, actually, I don't know how to do that, or actually, I've never done this before, I'm not comfortable with this. Could you please help me? Could you supervise me? The most important thing is patient safety. Try not to get distracted when you're doing quite an important task. So many times you'll be bombarded with information and requests from a lot of different places. You'll be bleeped, the nurse will be speaking to you, the patient will be speaking to you. But say you're, for example, doing a prescription, try to just focus on that one task and double check it in order to be as safe as possible. Also, make sure you prioritize according to patient safety and need. So, for example, if a patient's using a 7 and they're asking you to review them, that will obviously come before another patient that has a bit of pain and needs paracetamol. And always escalate as needed. Tip number 6, know the useful resources around you. So for example, know how to access trust guidelines, but also local and national guidelines such as NICE guidelines or guidelines from Royal Colleges. Also, make sure you download some useful apps. So ones that I found really useful for were MicroGuide, which has a list of the different conditions and the antibiotics that would be used for those conditions as first, second, and third line. In this app, you can also select what hospital you're working in, and the antibiotics would be specific for that hospital and that population. Another useful one is BNF or BNFC if you're working in pediatrics. And I'm sure you know it, but it'll have all the medications, the doses, the indications, the side effects, contraindications. So I'm sure that'll be useful in your day-to-day. Another one is induction. In this one, you can select the hospital you're working in. Say you want to speak to the respiratory registrar, then you just type respiratory registrar, and you should get an extension or a bleep for that specific hospital. Another one is MD Calc, which has a lot of calculations that can be done in the app. For example, if you're trying to calculate the QTC. Tip number 7 is keep your e-portfolio up to date. So I'm still working on this myself. As you will quickly notice, portfolios and sign-offs don't stop when you finish medical school. They go on for the whole of your medical career, even when you are a consultant. Whoever looks at your portfolio at the end of the rotation or the end of the year might have not worked with you, so the evidence you have here is very important. You might be a really good doctor, but if you don't have the evidence, there's no way for them to know. So make sure that at the beginning of the rotation, you go through all the requirements and the sign-offs you need, and you let your seniors know so you can plan together when you're gonna do them and look out for opportunities for these. One way to do it is set out maybe like a weekly goal. So this week I'm gonna get this signed off, or this week I'm gonna have this discussion with my senior, so that you don't leave everything for the last minute. Tip number 8 is make sure you check your rota and your payslip. Once you get your rota before the start of your rotation, make sure you go through it and that you know your rights and what the rules are in terms of safe working hours. For example, you're not allowed to work more than 13 hours in a row, or you're not allowed to work more than 4 nights in a row, and make sure that the rota is compliant. A way to do this is also to go to the BMA website, and they've got a rota checker here. So you can just input the rota and make sure that it's compliant. In terms of pay slips, whenever you get your pay slip at the end of every month, I know we're all really excited to just get paid, especially in F1, but make sure you look through it and make sure you've been getting paid the amount that you actually are owed. So the payslip might look really complicated, but actually it's really easy once you understand it. And I've got a video that you can watch to make sure that you understand it. And it's really important because so many times I've checked my payslip and I've realized that I've been underpaid, and I'm not the only one. Tip number 10, have an open mind. Go into every rotation with an open mind, even if you think that this specialty is something that you're completely gonna hate or something that you've completely ruled out. Still go into the rotation with a good attitude, because you're gonna learn from every single rotation and you're gonna learn from every single doctor. Some doctors you might really look up to, want to be like them or emulate them when you go further into your career. Some doctors you might not like, but you can still learn from that what you don't want to be like when you're a senior. During F1 and F2, there's going to be a lot of learning about what you like and you don't like in terms of specialties. So make sure you keep reflecting in every rotation things that you've enjoyed, things that you haven't enjoyed, and how this will help you choose your specialty later on. Tip number 11, which I hope is a given, but be nice to your colleagues. Colleagues are so important. Your life is going to be so much easier if you're just nice and smiley and come to work with a good attitude. Treat everyone with the respect that they deserve. You're just nice to every member of the team. That's really going to help create a good working environment, and also people are just going to be happier to help you if you ever need to. Tip number 12, document. Documentation is really, really important. It's legally binding. It's also going to make patient care a lot safer, because everyone in the team is going to be aware of what's going on with that patient and of what has been done and what needs to be done, what has happened that day. Also, it's going to protect you. If anything goes wrong and you've documented it, then you've got evidence. Anything that's not documented hasn't really happened. So say you're in a ward round and the consultant's giving you a plan and you're not really sure about it, make sure you ask and make sure you're confident that what you're documenting is correct. If you're referring to a specialty and maybe you've called a few times and they haven't answered, make sure you document. I've called this specialty this many times, I've not received an answer, I will call again later. Let's say you've escalated. Make sure you write down the grade of who you've escalated to, the name of who you escalated to, what concerns did you tell them about, what advice did they give you, and so on. The same goes if you speak to a family member. Write down what the relationship is to the patient, what the name is, what you updated them about, what questions they had, any concerns. Tip number 13 is master your patient list and your job list. So the patient list you will normally get at the beginning of a shift, and it's a piece of paper with all the patients, what bed they're in, condition or problem they're in with, the treatment so far, the investigation so far, their condition at the minute, and what the plan is going forward. So it's a bit like SBAR. In terms of the list, one of the jobs of the F1 will be making sure that the list is kept up to date and tidy. So make sure you learn how to do this. When you get the list printed, make sure you don't lose it. You will get into a lot of trouble if you lose it because it's confidential information. So make sure you carry it with you wherever you go and know exactly where it is at any time in the day. And in terms of the job list, so after the ward round, normally you will just sit down and make a list of all the jobs that need to be done. Normally you just do it by patient and by bed, and you just write a little square next to it. If it's not shaded, it's not been done. If it's partially shaded, it's partially been done. For example, bloods have been taken and sent, but they've not been chased yet. And if it's fully shaded, that job has been done. So it's very good to have it all in one piece of paper so you know what jobs you need to do, and also you can divide it with your other F1s or SHOs. And it just makes you feel more in control of what's going on and like you're making some progress. Tip number 14 is really important, and it is look after yourself. So this job can be really stressful and overwhelming and emotionally taxing. And it's really, really important that apart from looking after patients, you look after yourself. So make sure you take breaks. There's never going to be a good time to take a break, but unless there's an emergency, you should be able to go take your break. Make sure you pee, make sure you drink water, make sure you have some food, and make sure you leave on time. Unless it's a massive emergency, you should be able to leave on time and hand over any jobs that need to be done to the next doctor covering the shift. Remember that the hospital is 24/7 even though you're not. So once you leave work, there'll still be people working that can do these jobs. Make sure you come up with a routine for your night shifts because those can be quite taxing. Make sure you switch off once you're off work. You try not to talk to people about work, which is especially difficult for F1s and F2s because a lot of us lived with other doctors, but try not to talk about hospital stuff and try to make sure you keep doing the things that you enjoy, so be it exercise or hobbies, anything, and your job doesn't become your whole life, or that there's other things outside the work that you're still doing and that you're still enjoying. And tip number 15 is a related one, which is don't struggle alone. So a lot of people, I would say everyone will struggle at some point in their careers. And it's very important that you don't keep this to yourself and you don't isolate yourself, but instead you open up and you share your struggles with either trusted colleagues or friends or family. A lot of them will have gone through similar things and will be there to support you and give you advice. There's also well-being teams in every hospital that can help you either with resources or chatting to you or offering you free therapy. And the same goes for the BMA. Becoming an F1 or a new doctor is a big step. It's probably one of the biggest steps in your careers. And adapting to this kind of new life and new role can be difficult and overwhelming and complicated. But I promise it gets better. Everything is hard before it gets easy. But with time, you look back and you'll realize how much you've learned, how much more confident you feel, and how much easier everything is. Try to enjoy the process and ask for help and advice to those around you. I'm sure you'll be completely fine. It'll just take a little getting used to, but you'll be completely fine.